Lateral wall of nasal cavity. Lateral wall of nasal cavity has three turbinates: superior turbinate, middle turbinate, inferior turbinate. Lacrimal bone, maxilla bone, nasal bone, palatine bone. Lacrimal bone, maxilla bone, nasal bone, palatine bone. Openings in lateral nasal wall. Sphenoethmoidal recess. It is the opening of sphenoidal air sinus. It opens into nasal cavity. Sphenoethmoidal recess. Openings in superior meatus. Opening of posterior group of ethmoidal air sinus. Opening in middle meatus. Hiatus semilunaris has following openings. Opening of frontal air sinus. Opening of anterior ethmoidal air sinus. Opening of maxillary sinus. Sphenoethmoidal recess. Openings in superior meatus, posterior group of ethmoidal air sinus. Openings in middle meatus, opening of frontal air sinus, anterior ethmoidal air sinus, opening of maxillary sinus. Openings in inferior meatus, openings of nasolacrimal duct guarded by Hasner's wall to let tears flow into inferior meatus. Opening of Eustachian tube, present behind the inferior turbinate in nasopharynx. Eustachian tubes come from middle ear cavity into nasopharynx by passing through sinus of Morgagni. Sinus of Morgagni, space between superior pharyngeal constrictor and base of skull. Pharynx, front view of pharynx. There are three pharyngeal constrictors: superior, middle, inferior. They are constricting so that food can move down in peristaltic fashion. Sinus of Morgagni, it is the space between superior pharyngeal constrictor and base of skull. The middle ear cavity is aerated by Eustachian tube which enters the nasopharynx through sinus of Morgagni. Sinus of Morgagni, it is space between superior pharyngeal constrictor and base of skull. Middle ear cavity is aerated by Eustachian tube which enters nasopharynx through sinus of Morgagni. Structures passing through sinus of Morgagni. Eustachian tube opens into lateral wall of nasopharynx. Levator palatine muscle to elevate the palate and also helps to open Eustachian tube. Structures passing through sinus of Morgagni. Eustachian tube, levator palatine muscle, ascending pharyngeal artery, ascending palatine artery. Eustachian tube opens into lateral wall of nasopharynx. Levator palatine muscle to elevate the palate and also helps to open Eustachian tube. Ascending pharyngeal artery, medial branch of external carotid artery, it supplies the Eustachian tube and tonsil. Ascending palatine artery, branch of facial artery, it supplies the tonsil. Eustachian tube, levator palatine muscle, ascending pharyngeal artery, ascending palatine artery. Eustachian tube, it is 36 mm long, bony part, 12 mm from anterior wall of middle ear cavity. Cartilaginous part, 24 mm from nasopharynx. The cartilaginous part of Eustachian tube is made of elastic cartilage. Isthmus of Eustachian tube at junction of bony and cartilaginous part. Narrowest lumen of Eustachian tube is isthmus. Eustachian tube is 36 mm long, bony part, 12 mm from anterior wall of middle ear cavity. Cartilaginous part, 24 mm from nasopharynx. Cartilaginous part of Eustachian tube is made of elastic cartilage. Isthmus of Eustachian tube at junction of bony and cartilaginous part. Narrow lumen of Eustachian tube is isthmus. Coronal section of pharynx. Three parts of pharynx. Nasopharynx behind the nose. Oropharynx behind the oral cavity. Laryngopharynx behind the larynx. Nasopharynx, oropharynx, laryngopharynx. Eye. Development of eyeball. Diencephalon part of brain grows into eyeball to form retina and optic nerve. Neural plate ectoderm forms optic sulcus or optic groove. Optic vesicle. Optic vesicle comes in contact with surface ectoderm or optic cup. Diencephalon part of brain grows into eyeball to form retina and optic nerve. Neural plate ectoderm form optic sulcus or optic groove or optic vesicle. Optic vesicle comes in contact with surface ectoderm, optic cup. Optic cup has two layers, inner neural layer, outer pigmental layer. Later the optic cup forms the retina. Optic stalk forms the optic nerve attaching the diencephalon part of brain. Surface ectoderm in contact with optic cup forms first layer of cornea, eye lens. Major portion of cornea.